Hi everyone, my name's Jennifer, and for this assignment I chose to interview a nurse practitioner who is actually a cardiovascular NP in a hospital. She's actually a family nurse practitioner, but has fallen into the role of working with cardiac patients within a hospital setting at Largo Medical Center here in Largo, Florida. Her name is Stacy Kaniok. And she works at Largo Medical Center. I sat down and I talked to her. Her roles exactly are she works within the ICU there and works specifically with all pre and post cardiac surgical patients, along with thoracic surgeries as well. They have patients that go for cabbages, valve repairs, and replacement. They also do some VADs, wedge resection, decortication, and biopsies are some of the few procedures that they do. She sees all patients pre-surgery and post-surgery. She works with the surgeon for orders. She goes over education, medications, rehab that's going to be needed, post-op, and assist them with getting everything set up for home care after. When we talked about Biostatistics, they do what is called an STS, which is Society of Thoracic Surgery Risk Stratification Score. This score is basically a statistical prediction of each patient's risk of mortality, morbidity, long-term stay or short-term stay, if they're going to have a risk of stroke, prolonged ventilation, renal failure, or even deep sternal wound infection. They kind of go over the patient's complete history, they come up with this score, and then they discuss it with the patient and the family before surgeries, and the overall picture can give a patient a better idea of what they're to expect with the recovery phase, and if the surgery is actually going to help them or if it's just going to prolong the inevitable of a poor prognosis. So that is one part of statistics that they do use. And then there was another part that she discussed with me that each surgeon and the group, they go over quarterly of all the patients they've seen. They look at the surgeries, the type of surgeries that are done, and then the outcomes after, how long each patient was stayed, infection rates. Then they compare all the information with all their surgeons and kind of come up with a plan and look at the care for the future based on the past statistics and evidence-based practice. I really enjoyed this interview. I do love cardiac, so working with her and seeing what she does was pretty interesting. And that was basically it. Thanks for watching.